I wanted to rise in support of this bill and try to explain a little bit the dynamics of how this works from an industry perspective. When we started working on this bill, we were looking at a way to try to find a legislative way to make epinephrine more affordable. And as has been talked about here on the floor a bit now, this legislature only has the ability to affect plans that are fully insured plans. And this does cause an issue because fully insured plans is where we see the most amount of impact from people and price increases. It's the highest increase, it's the increase that's approved by DOI, and it's the one that we most talk about because it's the only one that we can truly affect. So when we started working on this, the point of getting the epinephrine on the lowest formulary was so that it would impact a broader base of people. In industry, formularies are put together at a high level, and they typically span through not only fully insured, but also self-insured plans. Most companies don't go out and create individual formularies for individual companies unless a self-funded plan specifically asks for something to be on or off their formulary. There's a generic template of formularies. And what this bill has done is putting an epinephrine injector, not necessarily EpiPen, but an epinephrine injector on the lowest tier of any formulary. So in doing so, you'll have an option to have an auto-injector at a $25 copay. And that will expand this, honestly, I believe, beyond just the fully insured market because it becomes part of the formulary template. And in doing so, we're hoping and expect to see that this is offered to a broader breadth of people with the ability to have it. The only thing that I would say is if there's a high deductible health plan, your deductible would still apply, but at the lowest formulary, the generic option of an EpiPen or an epinephrine injector is still going to be significantly less. So I encourage people to support this bill. I believe it does go out and attack the issue of the high cost that we see in epinephrine, but more importantly, it puts us in a position to have it on a formulary at the lowest level, which will have a broader reach across all kinds of plans. So it's a more accessible and affordable option for everybody. So while we will see some increase here or there, possibly in the fully insured market, the benefit of having the epinephrine around is it is a cost savings, because if you have to go to the emergency room because you don't have it, it's a much bigger bill. So I would encourage people to support this bill, to support it as it is. It is a good bill that is going to reach a broader audience, and it's going to make epinephrine more affordable for a larger amount of people than I believe, truly, than just the fully insured market. Thank you very much.